Hi, my name is Christina and this is Brandon. I am recording this video as part of the Deep Tendon Reflex Assessment video for a nursing skills course at Nightingale College. Brandon, do you understand and consent to participating in the skills demonstration video and being recorded for internal educational purposes, including grading and program review by faculty and institutional accreditors?
Yes, I consent.
Okay. All right, so the first thing we would do is we would walk into the patient's room, close the door for patient privacy. We'd perform our hand hygiene. Hi, Brandon, my name is Christina. I'll be your nurse today. I would ask for your name and date of birth.
My first name is Brandon. Date of birth is June 16, 1987.
Okay. Make sure I get 2 patient identifiers, which we did with his name band. And now I'll explain what we're going to do today. So Brandon, today what we're going to do is we're going to be assessing your deep tendon reflexes. This is done by tapping in various tendons and assessing the intensity of the reflex reaction. This is especially important for our pregnant patients because it could be an indicator of preeclampsia or eclampsia, as well as it can indicate a magnesium toxicity in patients who are receiving magnesium sulfate. These reflexes are graded on a 0 to 4 scale. 0 would be an absent reflex. +1 is a diminished or hyporeflexive response. A +2 would just be your normal response. And then +3 would be a brisk or a hyperactive response. And then finally, your +4 is going to be your hyperactive response or clonus response. So if the patient received a 0 or a +1 and they're on magnesium, we would be concerned of that magnesium toxicity. If a patient is pregnant and they get a score of +3 or +4, we would be concerned that they would have preeclampsia, especially eclampsia, if they have the +4 in the clonus. For this video, we are only going to do one side of the patient, but for a real patient, real scenario, we would want to do both sides of the body bilaterally, testing for reflexes in both sides. So we want to begin with the bicep reflex. So we'd want to have the patient put their arm here, rest it, and we want them to slightly flex their arm just a little bit, okay? And we want to find that bicep tendon. We're going to tap on that. And then I'll go ahead and test that. Okay. So what we are looking for in the bicep tendon, we're looking for a contraction of the bicep and a slight flexion of the forearm, which we saw. So that would be a +2. Next, we're going to check his tricep reflex. So if you could put your arm out like this. Okay. We want to find the tricep tendon, so if you could flex a little bit, it's going to be right above the elbow, perfect. And then you're going to just rest it. Okay, we're going to go ahead and test that. Okay, so we want to look for the tricep. We want to make sure the contraction of the tricep, and there should be a slight extension of the forearm. Next, we're going to do his patella. So for this one, we want to just feel under the knee for his patella tendon, and we're going to find that tendon, which is right here. Okay. We want to see a slight extension of his knee. Try that again. Okay. Next, we're going to be doing the Achilles, which is down here by the ankle. So we want to have him slightly dorsiflex the foot. Maintain a nice relaxed leg, so you don't want to put too much pressure on there. Now we'll find the Achilles tendon, which is right on top of the ankle here, right above the heel. Okay, lower it a little bit. Okay, and then we will test that as soon as we get the tendon here. Okay. We want to look for a slight plantar flexion. And then the last thing we're going to do is we're going to assess for ankle clonus. So this one we're going to want to, again, have them relax. And we're going to support the leg a little bit here. Can they see? We are going to quickly dorsiflex the foot. And we're going to make sure that we're looking for any rhythmic tapping or jerking with the foot when we flex it. Usually there's about 4 or 5 tapping in a row. This would be considered a positive clonus if it had the tapping. And this would tell us that the patient is either at risk for seizures, or if they're pregnant, they may have eclampsia. A negative reflex would be a nice, smooth dorsiflexion, flexion, and a release, which is what he had. Okay. I think that's it. So, all right, Brandon, we are finished here. I would put him in a position of comfort, make sure he's comfortable, perform hand hygiene, and then go ahead and document our procedure and findings.